Opioid-based medication can play a crucial role in your acute injury or post-surgery care plan. While risk of an opioid addiction, more commonly referred to as an opioid use disorder, is low, it can still happen to anyone, regardless of age, gender, or socioeconomic background. If you take care and follow your treatment plan, opioid-based medication can be safe and helpful. There are a number of different types of opioid-based medication, but they all work in the same way. If you were to injure your hand, special nerve endings send signals into the spinal cord and then into your brain, which in turn creates the sensation of pain. In order to dull the pain, your body produces natural opioids, which bind to pain receptors in the nerve endings, blocking the pain signals from traveling from one nerve ending to another. Opioid-based drugs work in the same way, by blocking the pain receptors and keeping the signals from reaching the brain. Unfortunately, when neurons are inundated with large amounts of opioids, they create more and more pain receptors. Eventually, more opioid-based drugs are needed to stop the pain, and in the absence of painkillers, the body actually experiences pain much more acutely than before. Not only do opioids block pain receptors, they also produce endorphins, which give the body an intense sense of euphoria. Like with pain receptors, the more endorphins you have in your body, the more you require. Your body eventually needs these drugs in your system just to feel normal. The chance of developing opioid use disorder increases drastically after only 5 days of taking opioid-based medication. Early signs of opioid use disorder include regularly taking more than the prescribed dose to address the pain, taking medication just in case you might feel pain later, increases in severe mood changes, borrowing medication from others, which could be family members or friends. If you notice any of these behaviors in you or your loved ones, talk to your healthcare provider for methods of tapering off these drugs to minimize withdrawal or other severe side effects. Withdrawal regimens are different for everyone. Your healthcare provider will help determine the best path for success. If you've been prescribed opioids, it's important that you take certain precautions to protect yourself and others. Make sure you are taking the correct prescribed dosage. A good way to do this is to place your pills into a weekly planner. Because most people who misuse prescription opioids get their pills from friends and family, it's important to lock your medication in a lockbox, particularly if you have children in your house. One adult pill can kill a child. If you have pills left over when your course is finished, it's important to dispose of them correctly. The best way to dispose of your medications is in a medication drop-off site, often found at hospitals and pharmacies. You can call your local law enforcement agency for a list of sites in your area. If there are no medicine drop-off sites, then there are 2 preferred disposal methods. Some drugs are safe to flush down the toilet. You can find a list at www.fda.gov/drugs. If your drug isn't safe to flush, mix it with an unpleasant substance like cat litter or used coffee grounds before throwing it in the trash. No matter what your disposal method, make sure you remove the label from the pill box before disposing of it. If you are prescribed opioid-based medication, take care and be your own advocate. If taken correctly and safely, opioid-based drugs can play an important and safe role in your pain recovery plan.